After you calculate your risk, if you find that you are at high risk, you should see a provider about what the recommendations are. However, if the recommendation is for you to consider taking a hormone blocker, the two medications that will probably be presented to you will be tamoxifen or Evista. Tamoxifen is used more in women that are premenopausal. Evista is used for women that are menopausal or postmenopausal. And this is only because studies were done with these medications and they're found to be more effective in one set of women versus the other. Now, these medications do have some side effects. The most common side effect of tamoxifen is hot flashes. There are other side effects of tamoxifen that include increased risk for blood clots and uterine or cervical cancer, but this risk is less than 1%. The risk reduction you get with tamoxifen is 40%, and this was a 5-year study that showed that there was a 40% reduction of risk. Evista or raloxifene has the same risk reduction, but not the same side effects, and it's also used with women that are postmenopausal. Now let's shift and talk about women who are diagnosed with breast cancer and their tumor is estrogen receptor positive or ER positive. When you're using hormone blockers in this instance, let's think of it this way. Your tumor has receptors, so these are open spaces representing receptors. When the estrogen comes in and binds with these receptors, it actually accelerates the growth of the tumor. So you want to block those hormone receptors. Tamoxifen is used for women who have been diagnosed with breast cancer stage 0, which is DCIS or ductal carcinoma in situ. The other hormone blockers are called AIs, aromatase inhibitors, and they're usually used with women who have stages that are higher than stage 0 or women that are postmenopausal. On rare occasions, these hormone blockers are used in women who cannot tolerate treatments such as chemotherapy or women who have chosen not to have chemotherapy. One side effect of the aromatase inhibitor that should be mentioned is that it can decrease your bone mass or bone density. So a bone density test should be at least obtained in the beginning and also monitored throughout your treatment. Remember, no two tumors are the same and no two patients are the same. So make sure that you understand all the information and that you make the choices best for you. Make sure you subscribe to my YouTube channel. You can find me on Facebook under April Liverman, and I'm also under Instagram and TikTok under Caretaker's Heart Speaks. I'll be having webinars on some of these topics that I'm discussing so we can go into them more in depth. So check out my website at Caretaker's Heart Speaks for that information. And you guys enjoy your evening.